PCOS or polycystic ovary or ovarian syndrome affects up to 10% of reproductive age women, making it one of the most common hormonal conditions out there. Even though researchers aren't yet sure what actually causes PCOS, there's still a lot of stuff we do know about it. They say PCOS might be genetic. It's usually genetic. It usually starts at puberty and it causes irregular periods, acne, fertility issues, and other hormone-related symptoms. But you know that's barely scratching the surface. Let's talk a little deeper about this. Let's sort through all this medical information to get to the nitty-gritty truth about PCOS, like can it be prevented, how can you manage PCOS if you have it, and what happens if you want to get pregnant. We'll cover it all. I'm Shani, your friendly pharmacist, and this is The Good Doctor. Symptoms of PCOS can vary, but they typically include irregular periods or even no menstrual periods at all. It could also cause problems with ovulation, which lead to infertility. Other common symptoms include obesity, especially in the upper body and stomach, oily skin and acne well into adulthood, and hair growth. Think of heavy facial hair and hair on your arms, chest, and abdomen.
Am I beautiful? How about this? And this?
In addition to infertility, PCOS increases your risk of conditions like type 2 diabetes and cardiovascular disease. You even have a higher risk of developing endometrial cancer. That's all pretty serious stuff. Is there anything we can do? Let's talk a little more about PCOS. When does PCOS start? So there's a lot of evidence that PCOS is probably genetic. Girls are born with it, but they don't manifest any symptoms usually until after their periods start, so around puberty. Do we know the causes? No. We don't know exactly why some people get it. It can run in families. There are just sporadic episodes and individuals too. There's a lot of variations in PCOS. It's not just one disease like diabetes or high blood pressure. There's actually a continuum signs or symptoms if people have PCOS. So what are the common symptoms? One of the most common symptoms we see is girls complaining of irregular periods. They may only have a period every 2, 3, 4, 5 months that often brings them in. Or they have signs of having excess testosterone, some of male hormones. You know, all girls and women have some testosterone, but a lot of women with PCOS have elevated levels, so they'll have a lot of acne, or they might have hair growth in places we don't want. Some women really don't get diagnosed until later in life when they're trying to get pregnant, and they have some infertility issues. It got its name, polycystic ovary or ovarian syndrome, because when it was first found, a lot of women who had it had little cysts on their ovaries, and that comes from follicles that don't really develop, so women don't really ovulate every month. But not every woman who has PCOS has this cyst on their ovaries. So when you're looking at criteria, it's a mix of maybe having irregular periods, maybe having signs of that excess testosterone, and a lot of times we see women who have weight issues, so obesity is a common factor as well. But the main 3 criteria are irregular periods, excess testosterone, and some of those ultrasound findings. Can you prevent PCOS? women can prevent getting it if you're meant to get it. You can actually help manage a lot of the symptoms. A lot of women have weight issues and they're obese and will start with lifestyle modification. So by losing weight, a lot of women can have regular periods again. Even 10% of weight loss can lead some women to getting regular periods and help them with their fertility. Also, PCOS can be managed with medications. There's really not a way to prevent it from happening because the concern is if a woman with PCOS doesn't have a period for 3 to 4 months repetitively, it can lead your lining uterus to get very thick, which can increase your risk for uterine cancer or endometrial cancer. So, what if I have PCOS and I want to get pregnant? Usually, it will start by looking at your history, and if you're overweight, losing weight is advised to start ovulating. A lot of women with PCOS have some degree of insulin resistance that you can be managed by what you call metformin. That's actually used for diabetes or pre-diabetes that also can help you start ovulating. If you think you have PCOS, what should you do? First thing you should do is go see your provider. And depending on the situation, you may need an ultrasound to look at your ovaries and your uterus as well. PCOS can increase your risk in the long run for you to have diabetes and high cholesterol, which ultimately can increase your risk for cardiovascular disease. So even if you're not worried about your periods of getting pregnant, it's important to have this diagnosed and try to manage it so you don't develop those things when you're older. But I have good news for you. PCOS is reversible. There's something you can do about it, and you don't have to live it forever. So here are the 5 easy steps you can take to reduce your symptoms and reverse PCOS. 1 is to cut down fructose. It's a type of sugar found in fruits and makes up 50% of table sugar. So avoid drinking sugar-sweetened beverages and fruit juices. Better if you choose low-carb options such as berries. 2 is to take apple cider vinegar. Yes, taking 1 tablespoon of apple cider vinegar diluted in water before your meals can also help to reverse PCOS. Apple cider vinegar helps to speed up how quickly our cells can absorb glucose that can significantly lower the blood sugar and insulin response. Number 3 is to eat carbs last. You heard it right. Eat carbs last. Eating carbohydrate-rich foods at the end of your meal after your protein, non-starchy vegetables, and fat can also help to make the insulin response to a meal less drastic. Number 4 is to reduce carbs. Low-carb diets have become very popular in recent years, mostly for weight loss, but also for PCOS as well. And the reason they are so effective for PCOS is, once again, because they improve insulin sensitivity, and carbs are what trigger insulins the most. Number 5 is to build muscle. The type of exercise you do matters. Exercise is beneficial for 2 reasons. The first is that when you're exercising, your muscle cells are able to absorb glucose without insulin. And the second reason is that more muscle mass means your body can store more glucose. Alright guys, that's all I have for today. For more tips and tricks, please like, share, and hit the notification button for more updated videos. See you next time!
To proceed with free online consultation, click the link in the comment section.